Hello, everybody. This is Heather Doty. Thank you for listening in. For those of you who are listening in after the fact, a crazy thing happened. I did the whole call with some awesome ladies. We had a great discussion on women's wellness, and I couldn't record the meeting. So I'm going to do the whole thing over and send it to all of you. I think there were about 100 of you who wanted a copy of this meeting, and I'm so honored to be able to talk with you. So it's just you and me here. We're just going to have a conversation. So again, my name is Heather Doty. For those of you I haven't met yet, I am a board certified family physician. I live here in Naples, Florida. I was raised in Pennsylvania. I did my training up there. I went to medical school and college in Pennsylvania, and then I moved to North Carolina, where I practiced for 20 years. And then my husband and I and our 4 children moved to Florida almost a year ago. And we live here in the Naples area. And I'll tell you a little bit more about myself in a bit, but you might wonder, why would a family doctor want to do a free workshop on women's wellness? So I have 2 answers to that. Number one, I'm with you. I'm one of you. So I've got a very vested interest in women's health. I'll be 49 next month, and I am definitely on a quest to pursue wellness myself, but also every patient who comes into my office, particularly my female patients in that midlife season, I just want them to be well, to feel well. I know that God has big plans for us. And so my heart and my passion is for patients to feel well, not just to stamp disease and throw medications at it, but to truly feel well. And so that's my heart behind this, is that I can maybe give you some helpful hints. Some of these things you already know like the back of your hand, because you ladies are super smart and well studied, and others might be new tips to you. So hopefully I can give you some new information that'll be helpful to you. So as I mentioned, I'm Heather Doty. I'm actually an osteopathic family physician, and my husband David and I have 6 children. They range in age from 26 all the way down to 13. The older 2, we have kind of a stair-step family. The older 2 are my honorary kids. The middle 2 are adopted from Ukraine, and the younger 2 are our biologic children. So I'm busy, and we homeschool as well too. So it's busy. And I also am the founder and owner of Crossroads Health and Wellness in Naples. And my colleague, Melanie King, is a nurse practitioner. She owns and operates Crossroads Women's Health in Harrisburg, North Carolina. She's got a beautiful new building there. She was on the call that would have been recorded if I didn't have some technical difficulties. And I'm also a certified fitness and nutrition coach. And I love to take a lifestyle approach to healthcare in general. Let's talk about health and wellness, first of all. So God gave me the name of my clinical practice a few years ago, Crossroads Health and Wellness. And so I just want to break that down for you a little bit, because I think it applies to what we're talking about today. So midlife is certainly a crossroads. Some people come to it, and some women come through it and they just sail through it really well. And others really kind of get smacked around a little bit, but it is a big crossroads. It's a big change. And then we talk about health and wellness. I want to talk about the difference between those two and how we apply them to our own lives. So health simply is the absence of disease or the absence of injury. That's pretty easy, right? So I check your labs, they look okay. You don't have a broken ankle, I'd say you're healthy, go on your way. But you might say, well, okay, but I don't feel great. And that's really where wellness comes in. So wellness is health. So it's the absence of disease or injury, but it's especially as an actively pursued goal. So it's not a passive process. It's something that we need to be very diligent, very intentional to pursue. We have to be very mindful of it. And that's why you're here. So I'm so thankful that you all are here. And I want to give you an example of something, just a lesson that I learned that I think it's just really important to recognize. So I think a lot of us would say, well, I'm not healthy, or I'm not feeling well because I'm too busy. I don't have enough time. And I completely understand that. I think we are all entirely too busy, but that's another story. So I kind of did a little experiment. So when I left my job in corporate medicine in North Carolina back in 2021, best job I ever had. I was with the same company for 20 years. It was amazing, but God called me in a different direction. to be home with our kids more. We had just adopted my two children from Ukraine. So I thought, this is fantastic. I wasn't feeling particularly healthy or well. Then I was feeling okay, but just not, not great. I thought, this is great. I will just have this big expanse of time and I will automatically get healthy. So that was in December, and May rolled around and I literally was less healthy. I felt worse than when I did when I was really busy. So time wasn't necessarily the factor. There had to be something different. And so that began kind of my own personal journey through midlife. And of course, I'm seeing patients in the office day in and day out who are also struggling and just not feeling their best. And so that's really where my journey began. And again, my encouragement to you is wellness is certainly achievable. It's hard. It's hard work. It takes time. It takes intention, and it takes attention as well too. And so my hope for you at the end of our talk today is that you'll have some tools that will really help you on your own wellness journey. You'll take away just a couple little things, a couple little nuggets maybe, or maybe you'll have a deeper desire to learn more. And hopefully this will keep you pointed in the right direction. My heart, my paradigm shift for medicine, it's the worst business paradigm, but it's truly from my heart, is that my patients would feel so well that they wouldn't need a doctor anymore. That would be amazing. That would be fantastic. And that's my heart for you, that you would feel well, that you could do everything that God's calling you to do. So anyway, let's move on. I want you to do a little exercise. Well, actually, let me back up. I forgot one thing. If you can remember that being healthy is just simply surviving, but being well is thriving. And that's what I want for you. So let's do a little mental picture, whatever age you're at. So I will be 49 in a couple of weeks. I want you to think a decade ahead, 2 decades, and 3 decades ahead, depending on where you are at in your lifespan. I want you to think of yourself in those decades, and I want you to picture yourself the very best that you can be. So I'm picturing myself at 50 years old, at 60 years old, at 70 years old and beyond. And what am I going to look like? What's the best version of myself in those years? I'm going to picture that in my head. And that's what I want you to go after, because I know that's possible. So I don't know about you, but I picture myself vibrant, running with my grandchildren, getting down on the floor, getting back up again, not getting stuck anywhere, just having the energy that I need to do everything that God's calling me to. And so I want you to picture that. And I used to teach my residents in the teaching program that I was a part of. I was on faculty for quite a few years. I said, you need to start how you want to finish. So I'll say that again, you can write it down. You need to start how you want to finish. I want you to picture yourself at 70 years old as a thriving grandma, doing all the things you want to do. You're traveling, you're spending time with the grandkids, you're feeling well, and that's where you're going to head. Okay? And it's possible. I know that it's possible. So let's talk. I want to go through the rest of our time. I'm going to take you through what I like to call the pillars of wellness. And here's what I mean by that. So if you can picture one of two things. So in my head, I'm kind of picturing Stonehenge, right? You've got these big, massive blocks of stone and then that are vertical. And then you've got the stone tablets on top, and they're kind of all supporting each other. Alternately, you could think of a table with maybe 5 legs under it as well, too. As you can imagine, if one of those legs is a little wobbly, you're probably okay. If one of those legs is missing and you have 5, you're probably okay. If you take away 2, it gets a little topsy-turvy. If a few of them are wobbly, the table's really unstable. So we're going to go through all of these pillars of wellness and acknowledge that they don't all have to be perfectly functioning all the time. This is real life. I'm a busy mom too. I totally understand. We can't do all the things all the time. But if you can leverage 4 or 3 of these pillars and really leverage them, and the other couple are a little off, you're going to keep moving in a direction of wellness. So think about that illustration as we're working our way through these pillars. So the pillars of wellness that I talk about are spirituality, sleep, stress, or lack thereof, actually, nutrition, and exercise. And then I've got a 6th one that I don't consider a pillar of wellness. Actually, it can kind of be a wrecking ball that can come through and just knock everything out. And that's women's hormones. So we can all relate to that. So I'll touch on that a little bit at the end. So it's not a pillar of wellness, but it's something that we really do have to acknowledge during this midlife journey. Okay, so let's get into it. I hope you have a pen and paper because I want you to take some notes, and hopefully I think this is still recording. I'm not very technologically savvy. So I want you to take some notes on this. So again, the first pillar of wellness is your spiritual foundation. I can't emphasize this enough. So this is where we start, because I believe that our Creator, Father God, knows you. He made you. He knows how you're hardwired. He knows everything about you. And so it's so important to stay in communication with him so that he can show you. There have been countless times where I've been just praying about a patient or thinking about something challenging with a patient, and he'll show me what we need to do. So he knows. So we need to tap into that resource. And number two, I believe with all my heart that he created us to be self-maintaining and self-healing. So yes, there's a place, certainly a place. I'm a physician. There's a place for medication and surgical treatments and all of those things. But generally speaking, most of the time, he designed us so that we can heal and regulate and age well and all of those things. So keep that in mind and just make sure that that's the one foundation, that's the one pillar you don't ever want to fall. That's the one of 5 that you need to make sure is completely intact. Okay. So number 1, your spiritual foundation. Number 2 is sleep. This is so important. So when I was on the call with the ladies just a little while ago, I asked them, how many hours of sleep do you get a night? And there were lots of 6s, some 7s, a couple of 8, but mostly in the lower end. And then I asked them, how many hours of sleep do you think women need every night? And people had varying guesses, but this is not a sexist comment. This is truly the biology of how we are hardwired as men and women, generally speaking. And there are some variances, but generally speaking, men need 7 to 8 hours of sleep a night, and women usually need 8 to 9. So if you're struggling on your wellness journey and your sleep isn't great, or maybe it's not sufficient or not enough hours, that is certainly an area where I would focus. And we always start there. If your sleep isn't restorative, your body's not healing, it's going to be in a state of stress. So sleep is so important. So if you can't sleep, and sometimes there are seasons, listen, I had 2, my biological babies were 17 months apart. I don't think I slept for 6 years. I think my oldest of our biological kids didn't sleep through the night until she was 5 or 6. So that was a long season. Sometimes there are seasons where there's just nothing you can do about it. But if you can, I want to give you some strategies. And we always start with lifestyle. So number 1, don't keep your phone near your bed, because if you wake up, I don't want you to pick up this thing and start scrolling, because that's going to cause dopamine to surge in your brain. Your brain's going to be very excited. That's your get up and go hormone, and you're not going to fall back asleep. So do not look at this thing. If you can't fall asleep, don't touch the phone. Put an alarm clock in your room if you need to, if it's too tempting. So that's number 1. Number 2, this might not be well known to many of you, but alcohol is a big sleep disruptor. I'm not saying don't ever drink alcohol. So don't hear me say that. That's another conversation for another time. But alcohol absolutely will disrupt your sleep. That drink that you have, maybe a glass of wine to wind down after the day, kind of roll into the evening, your body has to detoxify that alcohol for about the next 8 to 10 hours, and it will not rest until the job is done. Your body's faithful. So if you're finding that your sleep is really disruptive and you're having maybe a nightly glass of wine, just try for 2 or 3 weeks to abstain from that and see how you feel. Maybe it affects you, maybe it doesn't, but it's worth a try if you're not sleeping. So number 3, caffeine. I love a cup of coffee. I would love nothing more than to sit down and have a cup of coffee with all of you. It's my favorite thing to do. I love coffee. But the half-life of caffeine is 12 hours. That means it takes 12 hours for your body to get rid of half of the caffeine that you have. So if you have a cup or 2 of coffee first thing in the morning, that's generally no problem. By 8 or 9 o'clock at night, a good bit of the caffeine is gone. If you have an afternoon pick-me-up cup of coffee, you're going to be feeling those caffeine effects, whether you know it or not, into the night. And some people say, I sleep fine. I go right to sleep. Well, you're probably so exhausted, you fall asleep, but you really aren't sleeping restfully. So just consider it. If you're not sleeping well, maybe think about the timing of your caffeine. Keep it before lunchtime, 1 to 2 cups max, not in the afternoon if you can help it. Okay, so the other things that I want you to write down, magnesium glycinate. Most of you probably know this one. It's commonly talked about these days, but magnesium is very, very calming. The brand or the type that you need to take is magnesium glycinate. That's glycinate. Take it at bedtime. Of course, check with your physician first to make sure that there's not a contraindication, but there really aren't many for magnesium. And most of us are deficient in it. So take that about an hour before bedtime. I think that's one of my top 3 supplements that I would recommend for women in midlife. Very, very helpful. The other thing, and we can talk about this later, is progesterone. Progesterone is a hormone that really starts to drop around age 35. It's a calming hormone. It's one that really helps with our sleep rhythms. So if you are in your 40s and you're having trouble sleeping, you might want to talk to your physician about maybe talking about some hormones. We'll talk about that at the end, but progesterone is great for sleep in midlife. Okay, so we talked about the spiritual pillar of your spiritual foundation, and we talked about sleep, and now we're going to talk about stress or the lack thereof. So first of all, I want you to think where you are at on a scale of 1 to 10 in the last 2 weeks. 1 is I am cool as a cucumber. Nothing bothers me. 10, I am off the rails. I'm so stressed. I'm so stressed. See where you would average yourself out over the last 2 weeks. Stress is dynamic, it's variable, but on average, where do you find yourself? And be really honest. If you are a 5 or above, I want you to consider doing some of the things that we're going to talk about next, because stress increases your cortisol, which is a stress hormone. It increases glucose, which causes insulin to increase as well. It will cause insulin resistance, causes tremendous inflammation. So stress for so many reasons is just not good for us. And many times it's kind of up here for a lot of us. That's not to say some of us are going through some very, very difficult times. So I don't mean to demean that at all. Sometimes there are seasons of life that are just so stressful. I told the ladies on the actual live part of this meeting, I was reading in Colossians, I think, at the very end of the book a couple of weeks ago, and remembering that Paul wrote that letter from prison and he's in his shackles. I'm thinking he's in shackles trying to write this letter. He said he penned it himself, at least that letter he did. And he's writing this beautiful letter of encouragement and exhortation and all of those things. And at the end, he said, remember my chains. So he didn't complain. He just said, remember my suffering. And so sometimes we just need to just reframe our stress a little bit. Life is just so hard sometimes. So again, I don't mean to demean anything that anybody's going through. But let's find a way how to do that so that it's not self-destructive for us. So if you find yourself toward that higher stress end of the spectrum that I talked about, here's a couple of things that you can do. And I'm just going to throw them out there. We won't go into detail. I will do other workshops on these things, hopefully in the future. So the first one is grounding. Many of you may have heard about that. The easiest way to do that is to go outside in the morning in your bare feet. If you're walking the dog or something, just don't wear shoes, just go in your bare feet and let your feet contact the ground. There is actually an electrical transfer that happens when we do that really grounds us. It does exactly what it sounds like. So it can really ground us and kind of bring our whole autonomic nervous system into balance. And they've got all kinds of things out now, from grounding mats that you can stand on or grounding mattresses, all kinds of things. But honestly, the easiest thing is to go outside, just walk in your bare feet. But make sure to try to walk in the grass if you can, or a natural surface if at all possible. That's number 1. Number 2 is box breathing, BOX breathing. This is a technique that the Navy SEALs use when they go on these very high stress missions. It's so easy to do. I teach patients to do this. I teach my pediatric patients to do this. So easy to do. And so just find a YouTube video. But the short of it is you'll breathe in through your nose for 4 seconds, and then you'll hold the breath for 4 seconds. You'll breathe out for 4 seconds, and then you'll hold the breath at the bottom for 4 seconds, and you'll repeat that for a few cycles. And if you've got a smartwatch, You'll watch your blood pressure lower, your heart rate will lower, your nervous system will start to balance. It's a super easy thing to do. Do it when you're sitting at stoplights. It's the easiest thing to do. Box breathing. So try that. That's super helpful. If you can do that when you're meditating on scripture, that's even better. That's like a slam dunk combination right there. Number 3 is magnesium. We spoke about that already. We are all magnesium deficient. Hardly any contraindication to it, but still check with your doctor. Take it at bedtime. You only have to take it once a day. Magnesium glycinate is the best version. It's the best absorbed. Number 4, this is another one that you might want to look into. It's a supplement called L-theanine. It's an amino acid that is also an adaptogen. It is very calming. It's not something you need to take every day necessarily, but if you tend more toward feeling anxious or kind of spun up inside, definitely consider that supplement. Just kind of keep it on hand for those, maybe even those days where you feel a little bit more anxious. It can be very helpful. Also, consider the amount of caffeine that you're drinking. Caffeine can really worsen anxiety. You know, as family doctors, many of us, when we only have 15 minutes with a patient, I spend about an hour with mine, but in my old place of work, when we had 15 minutes or so, the easiest thing to do is just give them medication. And that's one way. It's not always the best way. Sometimes it's needed, and sometimes we have to do that. But if you can try these lifestyle things first, there's a good chance that they'll work. So L-theanine is a good supplement to consider and maybe look into. So we've touched on your spiritual foundation. We've talked about sleep, and we've talked about stress. So let's talk about exercise next. And I like to use the phrase muscle is master when it comes to exercise, because this is something that's new to me. This is something, one of the reasons, again, I wanted to do this workshop, because I wish I had known these things when I was 35. I would have done things a lot differently. Maybe, I don't know, hopefully I would have. I would like to have. So at age 35, women in particular start to lose 1 to 2% of muscle mass every single year throughout the remainder of their lifespan if they don't do anything to correct that. And here's why that matters. So it's not so much about looking good in a swimsuit or, you know, having nice contoured shoulders. Those are nice things, but that's not really health and wellness. The reason it's important is muscles contain more glucose receptors than any other tissue in your body. That's really important. If we can increase glucose receptors, that means when we eat various forms of foods that get broken down into glucose, those muscles can grab them up and get them out of the bloodstream so that insulin isn't surging, causing inflammation and eventually causing insulin resistance and eventually diabetes. Muscles can help you to prevent diabetes. Who knew? I mean, it's such a great thing, but it's the way God designed us. So I want you to do a couple of things for me. If you are not already working out, first of all, just make sure that you do this safely. So if you have a trainer, use the trainer, get a trainer, see me for fitness and nutrition coaching, whatever you need to do to make sure you do this safely. But I want you to lift weights 3 days a week. You decide when. I don't care if it's morning, afternoon. I don't care what day of the week, fasted, not fasted. It doesn't matter. I just want you to lift weights. And I want you to lift weights that are heavy, but that you don't hurt yourself. So 3 days a week, the way I personally do it, I do upper body one day, I do a leg day, that's for me on Saturday, and then a total body workout, which is chest and back and other things as well. So whatever you want to do, only 30 minutes each time, 3 days a week. That's all I want you to do. If you really want to do higher intensity exercises, so, you know, we just came from a decade where everybody was part of Orange Theory, CrossFit, spinning classes, all these high intensity workouts for very long periods of time. And we're realizing that actually is not helpful for women in midlife. It pushes us into a stress zone that can be actually really detrimental. So you really do need to be careful with your exercise routine. You might think that working out in the gym for an hour or two is good, and you might actually be sabotaging your own health. So if you were to come see me for health coaching, I would say work out 5 days a week, 3 days of weight training, 30 minutes at a time, 2 days of high intensity training, no more than 30 minutes at a time. And I might even take away those 2 days if you have thyroid conditions, if you have any kind of adrenal disorders, any kind of chronic inflammation, chronic stress, I might actually take out those, but I will never take away your lifting. That's so important. So if you change nothing else about your exercise pattern, I want you to pick up some weights, lift some weights. That's so important. It's pretty simple, but make sure you do it safely and have a system. If you don't have one, ask me. I'll be glad to share with you what I do. So again, we've talked about spiritual foundation, we've talked about sleep, we've talked about stress, we've talked about exercise, and now we're going to talk about one of the more important ones, that's nutrition. I'm going to really going to skim the surface on this one because we need to do a whole workshop on this. There's just not enough time for me to cover it all, but I want to give you the basics. I want to give you my perspective as a family doctor who focuses on fitness, nutrition, wellness. So there are all kinds of ways that you can eat. You could do paleo, keto, whole food, plant-based, all carnivore, all the things. I mean, we hear about all of these things out there. I will never say there's only one way to do it. So I've learned through the years that when I say this is the best way, generally it turns out not to be. But what I will say is that I want you to eat whole foods first of all. Eat whole foods. They put so many preservatives and things in our foods here in this country in particular that it turns on addiction centers in our brain. Legitimately, it's proven with brain scans. It turns on those same addiction centers, and it's really hard to break that cycle. But if you eat real food, whether you do a plant-based diet or you eat animal protein, I personally eat animal protein and a lot of vegetables as well, eat real food, you won't have those same kinds of cravings. And there's a reason. That's, again, another whole conversation, but there's a reason they make these, cause us to want more food, because it's good for the food industry. It's not good for us as a population. So eat whole foods, eat a lot of protein. Remember I said you need muscle when you age. You can't really get muscles unless you eat the protein to build muscles. So I want you to eat 30 grams of protein with every meal 3 times a day. So that's about 90 grams. That's just average. Your physician, or if you see me, we can calculate exactly how much you would need per day. But you might want to start, maybe a good homework assignment would be sit down and calculate how much protein you eat in a given day. And I bet if you're not tracking, it's probably maybe 30 to 40 grams. So I want you to eat more protein. That's really important. And if you are eating a plant-based diet, which is completely fine, there's good evidence for that as well too. Just try really hard to get in a lot of protein. It's just a little bit more difficult with a plant-based diet. So lots of protein. I want you to drink half your body weight in ounces of water a day. That's free. It doesn't cost you any time except running to the bathroom. That doesn't take long anyway. Half your body weight in ounces of water every single day. Someday we'll talk about intermittent fasting as a tool. That's another conversation. I'm passionate about it, but it really deserves a whole other conversation. I want you to eat some fermented foods. That's an area I'm just digging into now. The gut microbiome is directly connected to brain health. We need to feed it good things. I personally don't like kimchi. I don't like that kind of fermented foods. So we do a lot of, we have explored making kombucha and things like that. And fiber, 25 to 30 grams of fiber a day. So good for your digestive health. And it really helps with digestion and metabolism. Takeaway points, 30 grams of protein at every meal, 25 to 30 grams of protein a day, and eat fermented foods at least once a day. If you could eat it 3 times a day, that's fantastic. And drink half your body weight in water every single day. So important. You know, they say that you can't, I love exercise now. I never did it before, maybe a few years ago on a regular basis. I love it now. I really love it. But you cannot out-exercise poor diet. You all have heard that before. That's nothing new under the sun. You also cannot over-supplement or out-supplement a poor diet either. I went from seeing patients who were on maybe 15 prescription medications in my former job. That was kind of the norm. And now they're on maybe 15 supplements. And I'm just not sure that's the right direction we need to head in. Choose your supplements carefully and get your nutrients from real food, and then supplement where you need to, but at a minimum. Okay, so we've gone through the 5 pillars of wellness, and we're going to just touch just a tiny little bit on hormones because I want to give you a frame of reference from my perspective as a family doctor, and just maybe to just to get you thinking a little bit, because there's a lot of chatter out there about that. So when I graduated medical school in 2002, it was around that time that the Women's Health Initiative was published. Many of you know that study, and around that time, they looked at the data. It was tens of thousands of women on synthetic hormones, and it theoretically caused a lot of problems for them. So they said, when they interpreted the data, they extrapolated that data. They continued to follow women in the background. Decades went by. They pulled almost everybody off of hormones at that point. We were scared to death to prescribe hormones for women for really most of my career until the last few years. And then recently, within the last 5 years, they again looked at that aggregate of data and they said, you know what, we were actually really wrong about that. Hormone replacement in women can actually be a really powerful tool. It's not for everybody, but it is so much safer than we were told previously. So hormone replacement for the right woman can prevent bone loss, can prevent heart attacks. There's some data showing that it can prevent memory loss. So there's just so much good data out there now that it's worth a conversation. And here's how the conversation has changed. When I first started practicing medicine, we would say, when you go through menopause, meaning you've not had a period for a year, you're in menopause, then we can talk about giving you hormones. Well, at that point, you've been 10 years without having really much hormones in your body. You're just going at a gradual decline, really from age 35 on, but definitely in your 40s. And many women are just really silently suffering, thinking they're going crazy. They can't think straight. They're having mood swings. They're tired. They're wired. They can't sleep, all these things. And they're not really aware that those are premenopausal symptoms. And that's why I refer to hormones not as a pillar of health, but as that wrecking ball that can come in and literally knock everything down. I've seen it happen, and women are not aware of it. So if you are between the age of 35 and menopause, and again, menopause can range from 45 to 55 years old for women. It can happen across a broad span, but if you're between 35, particularly 45 to 50, and you're feeling some of those symptoms and you're not sure what they are, it's worth taking a look at. So we always look at all of the other pillars of health first. I always start there first. And then you look at hormones. If you're really stuck or you're doing all the right things, this is a common story that I see. I'm doing all the right things and I'm not feeling more well. I can't lose the weight. Things aren't changing in a good way. Then maybe think about hormones. And here's the other thing. Your doctor, again, we were trained to just treat based on lab tests because that happens after menopause. Your labs will change. You don't see the changes really in perimenopause, which is probably when women really need hormone therapy the most. So if your doctor says your labs are normal, then maybe seek out a physician who understands. I think that hormones are not necessarily tied to a lab value, but rather to the symptoms that a woman is having. So anyway, I won't go into a deep dive on hormones other than to say that it's worth thinking through. You're not alone. Those things can come in like a wrecking ball for some women, and they can make a really big difference if they are prescribed safely. You just have to be careful. There are a lot of people out there right now who are in it to make a buck, and they're really hurting a lot of people prescribing pretty recklessly. Just make sure to find a really trusted medical provider. So Melanie works in North Carolina. I work in Florida. So if we can help you in any way, reach out to us. We'd be happy to. So we're reaching the end of this little talk here that we're having. So let's wrap up. Well, first of all, let me talk to you about just maybe some things that I'm thinking about for the future. So I'm thinking about creating a little collaborative where we can kind of hash through some of these things in greater detail. So that's coming down the pipeline. Topics that I'm very interested in discussing with all of you would be intermittent fasting and how to use it wisely or when not to use it, a deeper dive on hormones, a deeper dive into nutrition for sure, maybe some mindset and stress reduction strategies, and then supplements. I think we could do a whole session on that and lots of other things. So I've got lots of ideas, but I'm just honored that you all are taking the time to listen to this. It really means a lot to me. And just know that I am cheering for you. You are not alone. We are in this season together, and women's bodies are kind of an amazing mystery. So we're kind of all working hard to figure out how we can navigate this season with grace and with strength. Because I really believe, again, I know I said it before, but God's got big plans for you. God's got big plans for us for such a time as this, as it says in the book of Esther, but we need to feel well to be able to do the things that he's calling us to do. So I want you to think through some of the things that we talked about. Maybe you jotted down some notes, do an inventory of the 5 pillars of wellness that I talked about, and see if there are any in your life that might be a little less stable that you need to shore up. or ones that you could lean into that are really strong in this season that you want to make sure are extra anchored? What levers can you pull? So maybe you're in a season where you've got little ones and sleep is just out of the question. Can you focus on other things? Can you drink your water during the day? Could you maybe do some resistance training? Can you focus a little bit on the easy approach to nutrition that I talked to you about? Eat more protein. Whatever you do, eat more protein. Lift heavy things. I wrote that in my notes. I want you to lift some weights. That's so important. It's so important. I hope this was helpful to you. Again, if you need to reach me, my email address is heather@crossroadsdpc.com. And Melanie's email, if you live in North Carolina, is melanie@crossroadsdpcnc.com. You can find me on social media. I'm Heather Curlin Doty on Facebook and Hey Heather Doty on Instagram. So I'd love it if you'd follow me there. I'm going to be posting lots of helpful content for moms and families in general. And just reach out if I can help you at all. I am taking new patients in Florida. I've got a few more spots left, and I do regular health and fitness coaching as well, too, if I can help you with that. And listen, my heart is for moms. If you're a mom on this call, because if we can affect our health, if I can affect the health of moms, those moms are going to affect the health of their whole family. So this is more than just about us. It's about what God is calling us to do. And for those of you who have families and children, it's about the people around us that God has entrusted us to. So as I mentioned, I'm cheering for you. I'm in the trenches with you. If Melanie or I can help you in any way, please reach out. And thank you again so much for listening. This was really fun. I really enjoyed interacting with you guys and my DMs, and I really hope we can keep the conversation going. And I hope you have a fantastic day.